Alright guys, welcome back. This is the second part. We will be discussing about the permanent maxillary canine. If you haven't watched the first video, go check it out. Alright guys, so let's begin with this. First, let's discuss about the anatomical landmarks of the canines. So basically these canines have four lobes. Alright, there are four lobes present. First is the labial lobe, which is in the front. Okay, labial lobe. Then there is the mesial and the distal lobes over here at the sides. And then there's a lingual lobe, which is called the cingulum behind. So these are the four lobes. Then we have got the marginal ridges. Okay, so there are two kinds. There is this marginal ridge and there is cusp ridge or cusp slopes. So don't get confused with that. Marginal ridges are these, alright. Marginal ridges. So there are two, mesial and distal marginal ridge, and there are two cusp slopes. These are also mesial and distal cusp slopes. So these cusp slopes are in the incisal ridge. They make the incisal portion of the tooth. Alright. So these were some anatomical landmarks. Now coming to the aspects. First we will discuss about the labial aspect. Okay, so this is the labial aspect. Alright, I didn't get space, I'll just write. This is the labial aspect. So what do we see over here? First, it is trapezoidal in shape, or it can be pentagonal shape also, like this. You can see this is a pentagon. Now the crown. Okay, so basically first we're discussing about the crown. Then we have got the mesial outline. So this is the mesial outline, right? So we see in the mesial outline that it is convex, right, over here in the cervical portion. And so we can just write that the mesial outline is convex from the cervical line to the contact area, which is the contact area. It is present in the at the junction of the middle and the incisal third. Okay, now the distal outline. The distal outline is this one, and this is also convex, but over here in the cervical portion it's a bit concave. Okay, so that is the difference. It's concave here, and then till here is your distal outline, and the contact area, it is present in the middle third. Now the incisal outline, it is formed by the two slopes which extend downwards mesially and distally from the contact area to the cusp tip or the cusp at the midline. Okay, so this is, as we had discussed in anatomical landmark also, the cusp slope, they form the incisal outline, right? Now coming to the cervical line. So the cervical line, it points apically like this to the root apex. And the last one, the labial ridge, as I had promised, I will tell you what is the labial ridge. In the previous video I had told, so let's see what is the labial ridge. It is very important and a distinguishing feature of a canine. So let's understand this. So the labial ridge, it is basically we know that there are four lobes, right? So the labial lobe, it is very well developed. Okay, it is the largest lobe over here. So the labial lobe, okay, it's well developed and it forms a linear elevation. Okay, over here it forms a linear elevation from the cervix to the cusp tip, and this linear elevation is nothing but the labial ridge. Okay, it's very simple. Okay, So this was the labial ridge. Again, let me ask, what is a labial ridge? The labial ridge, it is formed, it is a linear elevation. Okay, so first what will you say? The middle lobe, okay, it is well developed than any other lobes, and it forms a linear elevation from the cervix to the cusp tip. This feature is called the labial ridge. Coming to the lingual aspect. So the lingual aspect's geometrical shape is also trapezoid or pentagonal, and the crown, it is narrower than the labial aspect, so it is a bit narrower. Okay, and it has a well developed prominent cingulum. Over here it is a convexity in the cervical third, which is the cingulum, and there are well developed marginal ridges over here, strongly developed along with the cingulum. They form the lingual fossa. As we know, they form the boundaries of the lingual fossa. These are the lingual fossa. There are, see, two fossas over here, fossae, right? Now, coming to the mesial aspect. I hope it's clear till now, whatever we have discussed. Coming to the mesial aspect, first let's discuss about the labial outline. Okay, so what is this labial outline? So it is more convex. Okay, why is it so convex? Because there's a labial lobe present over here. That is why the labial outline is more convex. Then the lingual outline, it is S-shaped. Why is it S-shaped? Because there is convexity over here due to the cingulum. Then there is again a concavity over here due to the lingual fossa, and then near the cusp tip there is a little convexity over here, which forms like the S shape, like this. Okay, so S shaped lingual outline. Now the height of contour of the labial and the lingual side, both they have the height of contour at the cervical third. Okay, so there is a height of contour is at the cervical third. Then we have the area of contact. So the area of contact for mesial, at the mesial aspect, is at the junction of the middle and incisal third. And discussing about the cervical outline, it is pointing at the cusp tip and it is convex. And one more point, it is about the root. I think we will discuss it together only, with the root only we'll discuss, but I'll just tell you this point, that it is thicker labiolingually. The root is thicker labiolingually. What does that mean? That this thickness, it is more than the other mesodistal thickness. Okay, so this is the labiolingual thickness, and then if you see like this, there will be the mesodistal. That means this thickness. You can only see that from the labial side. Okay, coming to the distal aspect, it is almost the same. So the distal aspect is similar to the mesial aspect, except I've written the points. There are 2 points. One is the cervical line. So the cervical line, it is a bit lesser in curved. The curvature of the cervical line is lesser than seen in the mesial. Okay, and the contact area is at the middle third. It is at the middle third. Here it was in the mesial, it was at the junction of the middle and the incisal third. So what point we see here, the distal contact area is more cervical, that means towards the cervix, more cervical than the mesial third. This is one identification feature. We will discuss about this in the next video, but let's just discuss about the aspect. So the incisal aspect, the last one. So what do you see over here? The incisal aspect, it is diamond shaped. Alright, it is almost diamond shaped, and as we saw, so the labiolingual dimension, this dimension, it is greater than the mesodistal dimension. Alright guys, and one last point, that the cingulum, alright, the cingulum forms the arc, the cervical arc. So it is the cervical arc lingually is shorter than the cervical arc formed labially. So this was one more point seen in this aspect. Alright guys, I hope you liked the video. We will discuss some features about the root, the different identification features in the next video. Alright guys, thank you.